IS4A strategy, which emphasizes integrated and interoperable people-centered digital systems as a foundation for data-driven decision making. Our work is also rooted in the experience of Relaxis, the Latin American Caribbean network for strengthening health information systems, which over decades have promoted knowledge exchange and capacity building and collaborative problem solving across the countries. Finally, I would like to mention the Foro Becker that reaffirmed the importance of regional ownership and intersectional collaboration to ensure that all the data is decoded accurately with ICD-10. So with that said, this community practice also the aim to build and share roadmap of CRVS digital transformation. Also, our intentions are identify common legal, technical, and operational challenges and co-design and scalable sustainable solutions. So we are delighted to have the diverse and experienced group here. I see that we have around 63 participants at the moment. Thank you for joining and let's continue building our collective momentum. And with the further note, I was just saying that this is a multilingual forum, so each of us can and present, with the language that they're most comfortable with, as PAHO is English, Spanish, and Portuguese and French-speaking community. With the further note, I would like to pass the floor our senior consultant, Victor Hugo Alvarez, who will present the practical way, how the community practice is going to work. Over to you, Victor.
Thank you, Katri. So I'm Victor Hugo Alvarez. I'm an epidemiologist, MD, and I have the pleasure to now be collaborating with PAHO in the organization and management of this community practice created for the strengthening of birth certificates and vital records for Latin America and the Caribbean. I'll share my screen for the presentation. Before the presentation, I'd like to invite you all to participate in ask a question first by sharing like a personal experience about the practice communities. And this isn't a novelty, actually. We have been working in various community practices, and Relapses was my school in my community practice and guided us in how to coordinate or how to find a better orientation for communities that were responsible of civil records and vital statistics in my country. I am Colombian. And that experience has undoubtedly been the one that has allowed us to make gigantic steps towards this work, understanding that we had to gather efforts and sit around a table and talk. And when the committee was founded for the management of vital statistics in the country, with an administrative proceeding, allowing us to do it in an organized manner, in a routinary manner, we saw it working. So I'd like to hear if any of the participants would like to share your experience, comparing it with prior experiences of community practices about this kind of vital statistics and civil records. Go ahead. If there's anybody who wants to voluntarily start sharing your experience. For several weeks now, we have been announcing the kickoff of this community practice, a community practice focusing on the development and strengthening of civil registration and vital statistics, with an emphasis on the digital transformation that it requires for these information systems to be able to improve access and data quality. Today's schedule, once we have finished with the introduction, Victor, I'm sorry, but I think that Beatriz Plaza has raised her hand. Oh, I didn't see you. Sorry. Sure, go ahead. Okay, I just wanted to say that I'm delighted to be here. Welcome, everybody. And I agree with everything that Victor Hugo had said about the former experience with Relaxes, the very enriching experience we had for many years in sharing experiences, best practices among all the countries of the region, which was really successful. So it's wonderful that we can start with this all over again. Thank you, Beatriz. Okay, so as I was saying, these are some of the topics that we'll be addressing in today's meeting. So the first thing is I'm going to bring up some challenges that have the purpose of digital transformation in civil registration for the region. I'm going to talk about the practice community specificities. What are the objectives? How are we thinking to organize that structure and its performance, the participation modes, and what are the tools that we have designed to enable that interaction and the participation of the community's members. We'll also come up with some suggestions, action plans, and the next steps. So digital transformation of civil registration and vital statistics, RCV, is one of the priority lines that have been set in the action plan for the strengthening of information systems in healthcare for the region for this period that began in 2024 and up to 2030. All of that with the objective that we are able to reach the targets of the Agenda 2030 for the region. This digital transformation means a great challenge. It is the greatest challenge the region faces, since there are several elements that come to play. So the first thing is we must mention that civil registration and vital statistic records are fundamental for the legal recognition of people and for them to have their rights ensured and access to services as well. But it is also the main source for demographic information that allows us to better monitor the dynamic and the population structure. This civil record system is intrinsically linked with healthcare information systems, but it is in a bidirectional interaction, not only necessary for the systems for the addressing people and population, but the very healthcare system is also one of the main providers, at least in our region, is the most important data provider that is needed for the civil registration in terms of vital facts, as it is making contact with information in terms of the information that takes place from the moment a person's born to the moment a person dies. So this very natural interaction is what is desired to be more and more synergic, more and more fit, and that is mediated by several factors that come to play. And one of them is the digital identity component. The digital identity component is basically the key that allows us to optimize that exchange and interoperability uh, among the systems in healthcare systems and vital statistic and civil records. But the digital identity systems, which in many countries is a separate system different to civil registration, it very much relies, very closely relies in how strong the quality of civil records are. So there is also a bidirectional relationship there. And it is that key, the most important key that we should be considering to move ahead within that interoperability that we wish to have or desire to have in our system. But this is also empowered by the tools the healthcare system has, such as standardization and all the healthcare information, which has been provided by the WHO with the ICDs, and most particularly ICD 11, that because of its digital nature, it becomes an engine that promotes the uh, updating of systems and the interoperability for it to be optimized. And then for this, the ICD 11 standard will be paramount. And of course, the target here is to have a level of interoperability that can provide results and data and updated and timely information for a good decision making in terms of public policies. But the region also faces several challenges. And with this list, we have covered part of that, like the heterogeneity, the many stakeholders that partake in this vital and civil records, as well as technological gaps that pretty much are being shown in the technological developments of countries, but they also offer us an opportunity to learn from the several experiences of those that have done already better versus those that have a bit of a delay. The interaction with the systems of digital identity and everything that has to do with interoperability, which are challenges that we must be facing in that process of transformation. There are also uh, the administrative issues in the compilation of vital statistics and in also acting in the very information systems as well. We're going to see a little bit of an survey detail in terms of heterogeneity and as a challenge that we face in the region. This comes up because of a great institutional fragmentation. There are multiple stakeholders, multiple institutions, the countries manage this vital record and civil record statistics in a different way. Some of them are not just static, and some come with several other actors that need to be integrated in processes that are not easily articulated in nor integrated. In fact, an example here will be civil registration itself. Entities in charge of civil registration are very varied in the region, where some countries only have civil registration services. They, for instance, don't have identity systems, while there are other countries that have both the civil registration system as well as identification systems that are concentrated within a single or multiple entities, which generates an institutional diversity and a multiplicity of stakeholders that make it very complex to put together all the interactions and the coordination among institutions. And that's how we found a report by the World Bank that was conducted in 2019, where a profile was issued about civil registrations in the region. And we found that some are very much attached to the Ministry of Justice or and many other ministries that are public entities, public ministries. But also there are autonomous entities that are not part of governmental entities, or there's like an independent system, like electoral systems in some countries. So that very dispersed sort of structure is a challenge when thinking about the purpose that we are all having to be able to bring it all together and integrating them into one single system and having an interoperability system that can result into a better availability of information for decision making. Likewise, the spectrum of the regulation framework, of the legislation framework, is where all countries are going to be able to share, according to this report, a common um, legislation baseline where they follow international models suggested by the UN and international agencies that rule this kind of civil and vital records, where there's a certain legislation that is also being followed closely in the region, which at the same time brings a challenge as it demands a process of standardization in terms of the legislation to be able to at least achieve some common interactions and results in integration and interoperability. We all have civil registration laws, but not everybody has laws in terms of identity, data protection, digital signature, etc. So these are aspects which are paramount to continue with the process of digital transformation need to be observed. So systems are very heterogeneous. We have coexistence of systems, both manual and digitals, with tasks that are allocated. For instance, in some countries, civil registration tasks rely on the number of municipalities or provinces. So it's not a single entity. It is a responsibility that has been delegated to multiple stakeholders, like in the case of Colombia, which is shared with the system of notary offices and registration. In Argentina, there is an agency in each of the states that make up for that comprise the nation. Also, as we have said, the various legislation frameworks that demand that standardization. And the other aspect linked to this that has to do with digital identity is the level of progress that we have in the region. Now, this is an initiative that has been fostered by the World Bank since 2015, where identification for development suggests to create in countries ecosystems to enable an integrated identity system that is linked to the civil registration in an inclusive manner with high quality. There's also a very close relationship where digital identity systems very much rely on how robust civil registration itself is, but they also have an opportunity for development as they put together digital identity systems. In the region, there are only 11 countries that have digital identity systems that are working online. And to follow this line of the World Bank with initiatives of identification for development, the countries are not that many, those that have adhered to that and that have that support offered by the bank: Brazil, Honduras, Dominican Republic, and the countries of the English Caribbean. We have diagnosis done in Mexico and Peru, but we still have much to cover. And the emergent challenge here is to be able to incorporate the component of identity systems into civil registration systems in an effective manner. Likewise, and pertaining digital governance, A great challenge being faced right now is that the development or the transition of the analogical governance to the electronic one has been gradual and quite marked at a level of countries in the Americas. In this chart, we can find the index of electronic governance development, which is comprising several components. One of them is infrastructure. The other one has to do with citizen services. And the other one has to do the other element, the key element for the development of digital governance is quite varied. When we talk about that level achieved by the countries in digital governance, and an average is 0.66 in a ratio of 0 to 1, with a wide spectrum that goes from the lowest in IT, which is zero point 0.2, to the highest, being Paraguay in the region, Uruguay with zero point 0.8. Then the average in the whole region is zero point 0.6, which is pretty much at a level of the international median. Throughout the period being shown in this chart, and these are sets of data that comes from the Digital Development Observatory launched recently by CEPASI PAL to be able to monitor the progress in digital governance. From the relevant issues that the digital governance brings about is challenges in terms of that very governance. We still lack clear policies and a central authority that could harmonize and be capable to coordinate all the very dispersed stakeholders and institutionality that is very fragmented in the countries. This also goes through a very important baseline, which is technological infrastructure, which is kind of weak in general and mostly in the countries of the region. So while some had progressed to have an important digital file, very nicely developed with electronic systems and records online and digital signatures, some are still having manual and physical developments and systems. Likewise, the projects that go toward digital governance also lack oftentimes of that immediacy. So there are specific, you finish with one project and don't give continuity to it, which makes this rhythm to sort of not progress as fast as we wish it would. On the other hand, digital political agendas, there are multiple. So almost all the countries in the region, not all of them though, have a specific digital agenda that has been established and formulated. However, that doesn't mean they have a good roadmap. This is about, according to the thermometer of the very digital development and what is the status of things. So these are the most important specific topics managed by the digital agenda that are being assessed: governance, digital transformation, productive transformation, digital infrastructure, education, digital health, and emerging technologies being the most important topics of this agenda. However, if you can see what in this scale that goes from 0 to 3, we're halfway there. Maybe the country that's most advanced in this particular indicator of political agendas and digital political agendas are those at the southern part of South America. And so each of these thematic agendas are being breaking down in different topics. And in this specific part, I want to point at digital health, where, for instance, transfer for data management is quite poor. So it doesn't even reach a visible score within the digital agenda. And this is a challenge to make these digital agendas come true, that they actually have a roadmap, that they actually have individuals developing them, as well as budgets that are allocated to those activities. So, in terms of national strategy for digital governance, the topics included there are also quite varied. This chart here from OCDE assessed the situation of Latin American and Caribbean countries that established, or rather noticed, the in existence of some of the action lines for these digital agendas, and in a scale of 0 to 4, giving me intensity and color. As you can see, governance and service, that's where there's the most number of programs of or action lines. While one of the topics that we're very much interested in, interoperability, actually lacks having an expression in those digital agendas to actually exist. It's really weak when we talk about the action lines suggested by those digital agendas, which becomes a challenge for our target. Among other things, because when we talk about interoperability in the region, there's very little interoperability, to be honest. In our region, what we do have is a certain level of exchange among institutions, talking about data exchange, but they don't necessarily interoperate or interoperate. We can talk about interoperability when we find an exchange that gives a result of autonomous utilization from those that have access to data, which doesn't always happen. The interoperability frameworks then are not well developed. We have an important lack of standards to be able to make this exchange processes viable, as well as greater connectivity in terms of basic needed processes and the infrastructure needed for that information exchange among systems to exist. And the last issue for the interoperability is institutional resistance. And not only institutional, talking about the individuals in charge of this management, and that's due to topics regarding digital, the responsibility, the teaching and the data responsibility. And there isn't a clear standard in these processes of exchange and digital literacy as well. In terms of quality of vital statistic records from their own sources, we have a serious problem, which is the outdated data. This I bring to you comes from a report from the UN as well, that it only reaches 2015. But it is useful for us to see that in 20 years, the progress done in terms of completion features and the opportunity of vital records was not progressive. It sort of remained static. Here, for instance, we're talking about birth. This one is death. And you see the darkest areas and the number of countries and the proportion of countries that reach a complete level of records and communication of vital facts and information. But half the number of countries don't reach those levels. These are incomplete statistics and oftentimes absent. And the work done by CEPAL, CEPAL, to update this information by 2020 This is their conclusion. Only 75% of the countries in the region can reach 90% of births registered in terms of deaths. It's a lot more critical uh, with not as a complete set of information, with 82% of countries can only reach 75% in terms of completeness and opportunity. This is a landscape, the global landscape. Let's say that the Latin American region still uh, has issues in terms of coverage of the recorded deaths. This is also very difficult to measure indicator. According to the latest census of the last 10 years, where most countries have updated their census, and with the question being done about the registration of births and deaths, is that we are able to have a hint about the opportunity and the coverage of data, vital facts, as it comes to civil record offices. Although birth certificates or medical certificates that have to do with vital records may be a lot more timely, they don't always make it on time to the civil registration offices. And lastly, I must mention the levels of maturity of these systems in healthcare in a measurement done by PAHO on the information systems, where they apply this model of maturity, where almost half of the healthcare information systems are mostly in phase one, which is barely the awareness about the need to advance and the information systems toward processes of health transformation processes. So this is also a very important challenge. Nobody in the region has reached phase five, which is already featuring continuous innovation in all the components of healthcare information system components. So it's important to consider that within our processes. Well, after showing you this landscape, this shows how relevant it is to bring forth the creating of a community practice to be able to improve the management of information systems and civil and vital statistics records. So the first thing to remember is that to get there, and if we think about the initiative to identify for development, then people need to be at the core of all policies. And seen that way, the integration of corporation in charge of information systems management is important. Now, the process of updating of civil registration systems need to be addressed with a comprehensive and collaborative approach. And that's an opportunity that is being offered by the whole diversity that we have in the region for the various developments in this system. So there are many lessons that are already learned that we most surely be able to share in this new community of practice that PAHO is fostering, and that will allow us to continue with the application and implementation of best practices from these experiences that may be shared toward the enhancing and updating of systems in the Americas. And if in a prior session, when we announced this launch, we explained about the community practice, which goes about an area of knowledge that has to do with civil registration, healthcare information systems, and identification systems as well. The community practice includes all professionals, everybody working or researching or having anything to do with this area of knowledge. They get together and start sharing experiences and knowledge, which creates these communities of practice. The approach we have has a mission and a vision. The mission for this community to encourage an inter or multidisciplinary space, rather seeking the transformation of records through the incorporation of technologies, um, state-of-the-art technologies of best practice. And the community also has a vision to become the leading voice and the voice that supports and seeks for that process of transformation in the region, and all of that under the values of collaboration and inclusiveness that will allow us to enable the application of all the principles of the community of practice. Our main objective, we have collectively set the creating of a map. We cannot do it alone. We can do it together to reach tangible results. First of all, by identifying and recognizing ourselves and trying to spot what are those gaps that in order to build strategies that are sustainable and scalable for all the updating projects that are applicable to all the countries according to their own realities. So we have set out specific objectives for that, which are progressive in nature. First of all, to create this space, to enable the tools that allow us to gather together and to collaborate to be able to achieve each of those objectives with the expected results until we're able to reach a level of updating and a clear pathway toward transformation for civil registration of vital statistics. In order to get to that point, then all members who want to be part of the community of practice have organized in a structure where we distribute and allocate roles and responsibility, putting together working teams with a consulting team leading and offering information that it will be established and according to the leaders that have the most experience and knowledge and that are going to give support to technical teams, which will be operating the action plan brought about by the community of practice, which are going to have the support of the community promoters, which are usually those that define policies or that can give support financially wise to the development of projects. And there's always going to be a support of a facilitating team comprised by the technical team of PAHO. And for that, certain terms of reference have been put together to be able to work with those roles. We also believe for the management of the community practice, sets of indicators within an assessment, a system that is not only going to allow us to monitor the whole system for the confirmation and consolidation of that community practice, but also the follow-up of all the processes that we execute in time and that can allow us to also see what is the productivity of that collaboration and the results of that collaboration, as well as the impact and the implementation of the recommendations that may come from there, or the specific support that some country may receive in regards to processes for the national project. So this will also have together platforms for that monitoring So far, and with the announcements done and the invitation to enroll to become part of this community of practice, we have 116 registries, all of them in a survey that we applied for that subscription. And so they have voted for topics that they feel are the most relevant. And in the first place, when digital transformation being the most important, then with topics such as interoperability, the the need to actually have a current situation and gaps analysis in terms of civil registration and vital statistics in the region, to be able to uh, recognize what the gaps are and other work lines as training CRVS managers, governance issues, integration issues in healthcare and identity elements that are very important. And the miscellaneous topics that came about brought topics such as the integration of the ICD-11 and all this process. So altogether, with that first line of work that is common to all of us, and that pretty much all participants agreed, the participants have been um, put together as the members are working from the implementation of best practices, which will be all of those that we will be able to gather and recognize in the countries and that we can share as well with one another. So clearly, we will continue with the methodological roadmap given by the principles that have been formulated for the information for the identity information systems according to the World Bank. So this is a proposal, a work proposal that we are going to focus on, particularly in the recognition and the creating of those best practices. So how can we participate? So we have mentioned also in a former session that all members, hopefully active members, that are going to have the main role of being those building this community and the expected results through their active participation in projects and initiatives that are being brought about within the community, with the leadership of projects and the contribution and their knowledge in the development of skills for other members. And all these active members, which is the foundation of the community of practice, will be supported by a central group put together by active members, but will assume the co-leadership roles and support for the planning, for logistics, to be able to facilitate whatever works are done by the community of practice. And of course, this isn't a closed community. It is open for those such members that we've called observers to be able to know better about this community of practice. And as they understand what their purpose is and they recognize the benefit of participating as well, become active members. So we expect it is that quickly with these roles that have been defined within the community of practice. And this is a question we asked in the last session of how people would like to participate, and 42 people answered, and these are the results. Let's say that it is understood that there are certain skills being considered as an observer, but half of them are quite certain and committed to be active members. We still need people who want to participate further in elements of management and leadership. And in that survey, we also gathered that the commonality of people are having a great willingness to work with at least 1 hour a week, which can be quite fruitful in the work of the community practice. Most of them agree with a frequency in interactions and meetings that could happen either bi-monthly or monthly, and most of them prefer those interactions to occur midweek, either Wednesday or Thursday. So this is a very important information for us to be able to schedule what's coming next in the development of the community practice. We've also made progress in the tools that are not only useful for the management of knowledge, but they also be offering important mechanisms of governance in the community of practice that are very important. And that's the spaces for interaction and collaborating work. So we've developed a website with the purpose to bring for the availability of the general audience a repository of relevant information about the community of practice, what it does, what it produces, where they'll also be able to find the sharing of documents or results of the collaborative work being done in a public fashion. And this is linked, or let's say it's already available publicly, and it has a structure. I think I have a minimum time left for this, but fairly quick. This is the website already designed. It has several resources that will facilitate participation or to know more deeply about this community practice. And I go back to my presentation. So this is the face of our website, the website of our community practice. But we also have the SharePoint collaborating site, which is now private in nature, and it'll only be provided access for active members in the community practice. It'd be a private repository with others' documents, where they'll also have private and reliable spaces for that collaborative work. In days to come, we're going to provide a training for the use of these tools, and we'll run the tests so that every member can access these spaces of work and collaboration. For the suggested plan for months to come, we have suggested all these topics in the following up meetings after this meeting. And also training cycles available for members. Well, you can also have free access to that with some other people that may not be members of the community. So PAHO, via the online campus in public health, has suggested the putting together of these training cycles, which have from 3 to 5 webinars. We have suggested a first cycle to bring the introduction to digital transformation and the integration of these records. We've already started with the first session on June 12th, where we have the general view of PAHO on the landscape of digital healthcare. And the next one, we'll be focusing on technical components that are key for digital transformation, where we expect to be able to show about the regional initiatives of the agencies leading all the structure and organization of civil records and vital statistics. So those training cycles have a very specific feature, and that is that they will have certificates. So this is going to be of high interest. The next steps suggested then have to do with the membership of this community of practice, for you to also be able to socialize among your colleagues so that everybody can register and actively participate from this community of practice. Next month, then, what I told you, we'll have the introduction to the tools of management in the community. And so we'll be sending a survey that will help us uh, put together the profiles, not only for participants, but also for the civil records and have a more updated information of what's the institutionality, how is it that they're operating currently. And well, that will give us the pathway to start with the conversations and what are the issues, which are many, toward digital transformation and the confirmation of working teams. So these are the links. You're um, invited, all of you who are concerned with the management of civil registration of vital statistics. And this is going to be shared after this meeting, this survey, so that the members that have already registered can get to that individual profile as well. Thank you very much for your time, and we now open the Q&A session in the 1 minute that we have left.
Thank you so much, Victor. We would like to ask, there were a couple of countries that wanted to share their experience. I think it would be the good time, Bolivia, they had the experience um, of the digital notification systems, and Chile also wanted to share their country experience. Daily, would you like to share the experience from Chile?
Be fairly quick, I would like to share with all of you the experience that we've had in Chile, which has a long tradition of statistic gathering in vital statistics back to 1862, when we started from marriages, births, etc., that was done in churches and all. And those first records were the foundation for the development of a most formal and centralized statistics system in the framework of the strengthening of this tradition. Is that in 1982, we started with an agreement, rather, a permanent agreement between the Civil Registration, the National Institute of Statistics, and the Ministry of Health, with the purpose to ensure the coordinated production of data and vital statistics as well. And all of that according to the recommendations from the UN. This is an interinstitutional agreement that has been supported by the Supreme Court, and that is current, an agreement that has the purpose to oversee for the proper performance of the system and the constant perfectioning, and to ensure communication and detection of results. And every institution, talking about the civil registration system, has very specific tasks in data recollection, data gathering, and the Ministry of Health and the Statistics Institute would get together working with the processing of this data, with the Ministry of Statistics is the one in charge to convey the country a full analysis of vital statistics. So that's pretty much like the summary of how we do it in Chile.
Thank you so much, Daily. Um, I'm afraid, we are already had a full hour, and we won't have the translation services, the after. But if there's without the translation opportunity, if there's any specific questions, on how community practice, would work, um, please the ask now, and Maria Lydia can reply. And if not anything else, we would need to close today's session, and we will have the next one in a few weeks. No questions? Well, then I would like to thank on behalf of on PAHO and our team, and thank you, Victor Hugo and Maria Lidia, for doing all the work, to setting up the community practice. And I really hope to have the active participation across the region, the using the forum and the website, and also propose, like if there are countries who would like to share their good practices, we can provide the space to have the presentations and have the dialogue, across the region among the member states. But this is everything, from my side, and I would like to wish everybody a great weekend.